So we've had a lot of people contact our office confused about what's happening. I don't blame you if you're confused about the healthcare debate. It's been noisy, it's been contentious, a lot of information and misinformation. We understand there's a lot of heated opinions because it's extremely personal to everybody. There are people in poverty that need that safety net on healthcare. There are individuals that want to be able to buy insurance, but they can't anymore. Everyone has someone in their family that's deeply affected by healthcare. I get that, our team gets that, our state gets that, quite frankly. So here's what we're trying to do. We're trying to actually maintain some of the things that Obamacare did at the beginning. The idea they had wasn't a bad idea. How do we help protect people in the safety net, bring down cost and options for everything else? The problem was the execution didn't work at all. The cost actually skyrocketed. In Oklahoma, our costs went up 76% in healthcare just last year. We have Oklahomans that are paying $25,000 to $30,000 a year for their family, and their total gross income is around $50,000 a year. They can't afford half of their income to go to healthcare. So they're paying the fee, they're paying the fine now. In fact, 81% of the people in our state paying the fine for not having healthcare are because they're $50,000 and less and they can't afford the healthcare. So they don't have the healthcare and they can't afford it, and they also can't afford the fine and they're getting it. There's lots of problems dealing with the Affordable Care Act. I wish it was different, but it's not. It's a real problem and we have to address this. So what's happening this week? Initially today, we just took a vote called a motion to proceed to debate. Now that's not the vote. I've heard reported it was the vote. It's not. It's to open up debate and even to start that process. So we've started the process. Then over the rest of this week, we'll have lots of amendments. Those amendments will be brought by Republicans, Democrats, Independents. It'll be a very open amendment process. In fact, at the end of this is something called vote-a-rama is the internal term. That means unlimited amendments of anyone who wants to bring an amendment and try to change the bill. And so there'll be lots of votes over the next really 72 hours as we're working through the bill. At the end of it, I expect us to be able to pass something that'll probably be fairly simple on healthcare and won't be the final bill. That bill then will go to what's called a conference between the House and the Senate. We'll take the House product that was passed that we also won't vote on in the Senate and don't agree with everything there. We'll have parts of it that the Senate will pass. I'm sure the House won't agree. And we'll have people sit down together and start working through the differences between the House and the Senate bill. That'll happen throughout August. And quite frankly, the Congressional Budget Office will take a long time to be able to score that. Usually when they do the scoring of how much things cost, it takes about 3 or 4 weeks. So most of August we'll be negotiating a final product, getting a score from the Congressional Budget Office to hopefully bring us to a final vote, I think sometime in mid-September. And we'll be able to pass that to the House, the Senate, and be able to go to the President's desk for a signature. I think it's incredibly important that we do repeal and replace Obamacare. People need security in healthcare, but they also need to be able to afford it and have greater options. We'll work through that process over the next several weeks. We encourage you to continue to stay engaged in our office. We'll try to get you accurate information of actually what's happening and try to keep you informed. Thanks for sharing all of your ideas with us. Quite frankly, this bill will be limited to only budget items because it's called a reconciliation bill. All we can deal with are budget items. We have a lot more to go on healthcare. There'll be other bipartisan bills in the days ahead dealing with prescription drugs and so many other things that we do need to address as a Congress and how we're going to deal with costs in the future. Continue to share your ideas, and I look forward to keeping the conversation going with you and here in the Senate.